Good afternoon, everyone, and thank you for joining us today. We're continuing in National VOAD's Adapting to COVID-19 webinar series. Today, we'll be specifically focused on serving vulnerable populations. Right now, there's no shortage of challenges that we've seen in a COVID-19 environment, and in the past few weeks, in this webinar series, we've addressed quite a few that the voluntary sector is facing. But I think today is especially important because we know that after a disaster, you will see, certain populations always have greater impacts than others. If you're vulnerable before, you are extra vulnerable after. But we're seeing in this pandemic that is still true, and that certain populations are really feeling just some unique challenges. And for a lot of us on this call that are to serve as many as possible, we hope that this will be a really valuable time of learning from each other, asking how we can adapt these practices to our current context and community, and just have the conversation, because we all may not be very aware of what some of these needs are. And that's why we have this esteemed panel with us today to talk about what they are seeing, what they've experienced, the practices that they're putting into place for those specific populations in this time. Now, as of now, we know that specifically people with disabilities, children, the undocumented, the medically fragile, and minority populations are experiencing severe impacts in this environment. And today we're just going to discuss a few of those, but I hope that this will just be the starting point for how you can really expand the way that you look at your current services to make sure that you're meeting the needs of all the populations that are being impacted right now. So I want to thank our panelists for being here. It is incredibly busy times, and so I appreciate each of you for taking the time today, and a special thanks to Dennis Clancy at Team Rubicon and the whole team there for the coordination and the technology support for allowing us to do this today. So on our panel, we have Marcy Roth, World Institute on Disability, Bart Farrell, Catholic Charities of the Archdiocese of Galveston, Houston, Sarah Thompson of Save the Children, and Dr. Nicolette Lewis-Saint from Healthcare Ready. So thank you all for being here today. Now, to start us off, if you wouldn't mind just taking a few minutes to introduce yourselves, your organization, and the work that you're doing in the COVID-19 environment. Bart, how about you start us off?
Excellent. So Bart Farrell with Catholic Charities of the Archdiocese of Galveston, Houston. I currently am the Chief Operating Officer, formerly the Chief Financial Officer. We are focusing heavily on food and rent and utility assistance, and we specialize in the undocumented area of vulnerable populations. We had a large response to Hurricane Harvey, as you can imagine. After in 2017, we're still in that work today, and still have another year to 2 years left on that. Prior to my work here, I was at Catholic Charities of the Archdiocese of Oklahoma City, and came into them shortly after the May 2013 tornadoes, which decimated a school and had a lot of recovery behind that. So I've been in the disaster arena for a while, but happy to be here and share my experience in Galveston, Houston.
Great, thank you. Sarah, let's hear from you next.
Emergency programs that save the children. Can you hear me all right? All right.
Yes, you're good.
Okay, so Save the Children has been working around the world in the U.S. to help protect children in emergencies for nearly 100 years, and we've been responding here in the U.S. since Hurricane Katrina, where we primarily focus on distribution of child-friendly goods, child protection issues, education recovery, and psychosocial services. And just like everyone else, this has been an interesting time in how we adapt our programming. A lot of people don't know, but we actually also run rural education programs in 14 states. And the majority of our focus for our COVID programming has been focused in those states. We've been providing educational supplies and feeding supports to nearly 90,000 children in 200 communities, serving up to 800,000 meals per day. And, that was a stretch for us. But we do know that there's just a wide-scale learning loss potential with this crisis, as nearly 95% of schools were out of school were out of school at one point. We know many school systems have closed down for the year or switched over to online learning. And of course, there's a digital divide. So that's something that we're really paying attention to, wondering about the long-term lasting effects of that, particularly for the youngest kids. And then the second part that we're really focusing on is childcare. Childcare is a very disaggregated, very complex sector, and it is being threatened in terms of its viability. A poll recently said that 64% of childcares without additional funding support may close down within 1 month of not being able to operate, and nearly half of that, 30%, said they would potentially shut down after 2 weeks. And now we are, a couple months in after that. And so there's potentially wide-scale loss of childcare coming in and out of this. So Save the Children is leading a national working group around emergency childcare for essential workers, where we're bringing together national key stakeholders, and particularly looking around problem solving and data and assessment, really understanding what the problem is, via flexible funding streams, as well as what are the program and safety guidance out there. We've seen a lot of information come out and a lot of information change very rapidly, but making sure that that is really applicable to the programs on the ground. So thanks for having us.
Thank you. Nicolette.
Hi, everyone. Thank you for having me. I serve as the Executive Director of Healthcare Ready. I'll start there. The organization was actually created shortly after Hurricane Katrina, and the idea was to form a public-private partnership focused on linking all of the parts of the healthcare supply chain with the communities and the patients who needed it most during disasters. So we are both focused on the operations and the continuity of the supply chain during a crisis, but also to the end of making sure that the patients who need that health care, the medicines, the medical products that supply chain is moving can get those medicines in a crisis. And so for our organization, we are mainly domestically focused. What we have seen is that in the 15 plus years since we were created, we've responded to pretty much every county across the United States, and the supply chain being global is especially important during a pandemic. So while we are in fact focused on the medical needs that arise from COVID, it's also important to remember that more than 70% of Americans are on at least one prescription, and our chronic disease rates are incredibly high. And especially when we're thinking about communities of color and historically disenfranchised communities, they are going to be, as you said, made more vulnerable by this moment. So even if they didn't have a healthcare need related to COVID, they may still already have a healthcare need that could be disrupted by COVID. And so that's really where we've been focused, is making sure that not just the hospital systems, but what we call ancillary care, pharmacies, community hospitals, federally qualified health centers, clinics, they need to be able to treat patients and protect patients that are chronic disease patients, just like every other facility. And so making sure that they have not just the equipment, but that they are able to prepare their workforce and communicate with those communities to make sure that they know that they're available and that medically fragile patients don't have disruptions, especially in those communities of color, is a big focus of ours.
Great, thank you. Last but not least, Marcy. Oh, Marcy, we can't hear you. Oh, sorry, still can't hear you. Oh, there we go.
Oh, okay, good.
We got you.
Very good.
The magic button.
Very good. So I'm Marcy Roth, and I'm the Chief Executive Officer for the World Institute on Disability. We are called WID. WID was originally founded in 1983, one of the first global disability rights organizations founded by, led by people with disabilities, and that's been WID's focus for the past 37 years. And I have been with the organization for about 7 months. Prior to that, I was the founder of the Partnership for Inclusive Disaster Strategies. And prior to that, I spent just about 8 years at FEMA as the director of the Office of Disability Integration and Coordination, and senior advisor to Administrator Fugate. I have been working in disability rights, and particularly in the context of emergency preparedness, disaster response, recovery, community resilience for many, many years. And right now, my focus and the focus of my organization is the 61 million Americans with disabilities and over 1 billion people globally who have disabilities. As we get into more of the discussion today, I will look forward to connecting some of the dots around, COVID-specific impacts and the work that we all can be doing together to use the rights that people have to their advantage and to the advantage of the whole community to optimize limited emergency and disaster resources and maximize outcomes for the whole community. So I'll talk more about that as that chance.
Thank you, Marcy. So much important work being done by these 4 individuals. I just want to remind you all that you can submit questions in the Q&A box, so please go ahead and do those throughout our discussion today, and we will try to get to as many as we can at the end of the hour. Okay, so launching into our discussion, I think, unless you are intimately working specifically with these populations, you might just not know what are the challenges that they're facing. So if I could hear from each of you just what, in our current environment, what are these populations, what does the day-to-day reality and challenges look like for them? Feel free to pipe up, whoever wants to start us off.
So for the undocumented population, I think one of the big things is many benefits won't be available to them, right? They may not be eligible for unemployment, especially the federal unemployment that's so vital for restaurant workers who have been maybe furloughed or hotel workers that have been furloughed, and it really gives them that step up. There's a lot of government aid coming down, especially in Galveston, Houston, for rent and to help folks pay rent and keep them in housing. But a lot of that is going to be tied to a lease and proper documentation that they may or may not have. And so for us, it's really about being very clear about, are there barriers for things, and what can we do to fill in the gaps where other things where other funds are available. And so really getting the information out to them, because they may not be banked, they may not be mainstream, we may have to go to certain populations and do it in other languages, not just Spanish, but other languages. And so those are some of the things we're seeing here in Houston.
I would say for our populations that we're focused on, it's so multi-layered and so intersectional that it's almost impossible to say, here is the issue. When you're thinking about chronic diseases for any person that has a chronic disease, managing that chronic disease is difficult. If you compile that with questions around employment, or rather unemployment, that may be connected to insurance, one's ability to continue to have consistent transportation to be able to get prescription refills, questions about whether or not you can connect with your provider, or just being predisposed to things that would increase exposure or increased outcomes from infection, right? So when we talk about, for example, the risk posed to communities of color by COVID, it all has to do with risk and outcomes. It's nothing to do with actual race. It's what other inequities have done to create other challenges for certain populations and disparities. And so when we're thinking about what we're seeing right now, it's all about the way in which inequities are compiling to strain one's ability to maintain their care, to maintain their well-being. So it's never just one thing. And that's part of what makes it difficult to identify what the vulnerable population is. It's not just that Black people are vulnerable or not just that diabetics are vulnerable. It's how you're able to navigate the systems that you need to maintain your health and whether or not you're able to do that freely. And that's what's going to determine your vulnerability. So I think our first challenge is just identifying who is vulnerable and then figuring out how do we provide the support that can actually fill in the gap that exists because of that vulnerability plus inequity.
This is Marcy, and one of the greatest challenges that we face is that we use a lot of terms that describe people with disabilities. We use terms like chronic illness, underlying conditions, vulnerable. We use all these terms, and people with disabilities have civil rights protections. And so we miss the opportunity to optimize those protections because we're not using the advantage of disability. We fought very hard to earn those rights. We fight incredibly hard to keep them. And what's been unbelievably magnified in this unbelievable public health disaster is, the 20,000 plus people who've died in nursing homes. Virtually every one of them is a person with a disability. You don't go to a nursing home because you're old. You go to a nursing home because you couldn't get the supports and services that you needed in the community for a wide variety of reasons. So you go to a nursing home because you have a disability, and we knew that nursing homes were a really bad idea before COVID, but if we weren't sure, we're really sure now. They are bad places. Congregate settings, lots of people with disabilities in detention, other correctional facilities, corporal, there is a long list of dangerous places that people with disabilities, people who are multi-marginalized, are dying. And at the same time, people who require in-home support in order to stay out of the acute medical system or the horrific long-term care environment, those in-home supports, for a whole host of reasons, have been interrupted. And some of that interruption was absolutely foreseeable. The fact that we pay the people who go into people's homes and support them, we pay them a minimum wage. We pay them, we don't give them benefits, we don't give them overtime. So many of the issues that have all come together to take a really bad situation and make it so much worse are things that people actually have legal protections against. So I'm hoping that as we have this discussion today and moving forward, that we might all join forces and use those civil rights protections that the people that we're talking about in a lot of this discussion, we use those civil rights protections to optimize outcomes for people with disabilities. And oh, by the way, while we're doing that, we're also strengthening the rest of the system. Because the more we keep people out of the acute care system, the more able that system is to meet the needs of people who really need it. So I hope this is the beginning of the discussion and not a one-off.
And I'll follow that. I guess one thing that people don't realize is that children, infants, and toddlers do qualify as children who have access and functional needs. So I think that's a good segue there in terms of how we're thinking about emergency planning and things like that. But in terms of some of the day-to-day things that might not be apparent to people who aren't working with kids every day or don't have them running around their cameras for all the online meetings you currently have, is when kids aren't going to school, which I talked about previously, a lot of kids, particularly kids in rural areas or kids living in poverty, don't have access to food. And that's a big problem. That's a big issue that I'm sure that many of you have either contributed yourself or are working with organizations that do food support. Another thing to realize, and again, you know this if you have a child in your home, is that parents are stressed. And parents are now not only the caregiver, they're the teacher, they're the guidance counselor, they're everything. And unfortunately, what that means when the stress levels go up, including financial loss and things like that, that sometimes they take it out on the kids. And there's been a huge uptick in instances of child neglect and child abuse and overall child protection issues. And not to mention, kids might have access to online learning. They might have the tablet in front of them to keep them company during some of the day. There's a lot of online issues too in terms of child protection and child safety that just we don't have figured out yet, and that's a big question mark. And then of course they just have, when they're not going to school, when they don't have access to their friends, they don't have that access to the social emotional supports that they need, that they rely on, that trusted relationship with a caregiver or teacher that they need to emotionally evolve and cope. Kids don't have the coping mechanisms that we do as adults. They haven't necessarily faced things like this before. And so they are looking to us on how to react. And if we're not taking care of ourselves, if we're not providing them with constructive learning, constructive ways to get out that stress, it's compounding the problem within the environments that they're staying in.
Thank you. So no shortages of challenges for people across the board, and unfortunately they're mostly complex. It's not, sometimes it's a food box and hopefully that helps, but a lot of times it's a lot of compounding factors. So thank you for that. So as we're all looking to expand or adapt our services, what services have you seen implemented or have tried, or lessons learned in service adaptations that are going on currently that you can share with folks who are looking to expand and serve these populations better? And I'll kind of piggyback on what Marcy said. What are some opportunities that maybe we're not taking advantage of currently?
I think we have to deploy technology. One of the things that we've run into is this is not just affecting a certain part of a city or a certain geographical area that we've seen in other disasters. It's affecting everyone. And so there's scarcity everywhere. There's resources that are limited everywhere. We're not getting donations from across the country because everyone's in the same boat. But we need to leverage technology in terms of allowing folks to submit for and access services. Maybe it's an online portal to see if they qualify for rent assistance in our case. We've had to do the same thing in our food pantries where we're handing out food. We just can't handle the volume that's needed. And so we have to limit it. And that's by having people maybe sign up online, giving them a number so that we know that they've signed up and we can match that to our sheets as they're coming through the line in a drive-through scenario. Honestly, our phone system can't handle it. We're getting something like 100 calls an hour just locally in one of our locations to a crisis hotline. And it's crashing the phone system because there's just not enough lines to handle it. And so distributing those calls and finally look at outsourcing, right? If we're not good at it and if we don't have the technology to do it today, can we outsource a model for a call center? Can we outsource a model for a lining up thing for a food pantry? I think all those things we have to evaluate because it is so different than anything we've dealt with before.
Bart, quick follow-up question for you. You mentioned phone lines and online portal. What have been successful outreach, services for you as far as letting the public know that you're there and available? I know specifically with undocumented population, sometimes there's a hesitancy to look into those things.
We had a better than expected response we invited the news media out for one of our food distribution sites. And obviously the next day we were overrun with folks coming out to do it. We had targeted especially Spanish language TV. And so we got both local Spanish language TV stations out to do that. We use a lot of Catholic radio and areas where we can do multiple types of print to get that word out. We also found individual communities. Sometimes SneakerNet's faster than the internet. They talk faster than we can ever communicate. And so finding them in the community and spreading the word sometimes is even better than live TV.
I think one thing that we've seen is we've tried to take the approach of delivering all of our services on multiple platforms, so at least 2. So if we have a web service, how do we make sure that we also have a phone option? If we have something that is available, for example, our RX Open map that's reporting the status of pharmacies and dialysis centers, it's really hard to turn that into something that is on a hotline. However, we've partnered with a lot of our NGO partners that have hotlines to say, if someone is calling you, you can access it and we're going to walk you through how to use it and give you the playbook. But the other thing that's been really interesting is radio. So radio is, in my mind, something that, super important. Honestly, I haven't listened to a radio station consistently in a long time, but most people across the country get their news on the radio. And so how are we having conversations on the radio, and how are we actually advertising services and sharing information on the radio? So something that we found ourselves doing a few weeks ago was just putting together bullet points and resources in packets that we could send to radio stations across the country to say, if you only have 5 minutes in the course of your entire radio show, here are the things we want to make sure you tell people. And it wasn't about what Healthcare Ready is doing. It's what do they need to know about COVID and their health? And that is something that we found they were really willing to take up, because a lot of the radio stations across the country have Q&As and people are calling in with questions. They're not equipped to give the answers. And so they needed that. But I do find that in this particular moment, a lot of folks, especially folks that have low technology options, are leaning on radio.
Yeah, that's a good point.
So some of the opportunities that we have, I think, first and foremost, because the federal law, the Rehabilitation Act of 1973, requires that every federal dollar be spent in to achieve equal access, physical access, program access, effective communication access. And the federal requirements for the use of federal funds doesn't just stop with the federal government's use of those funds. It also requires compliance from every subcontractor, grantee, sub-grantee. I tell you all of this to say we're letting the government off the hook by not using that very powerful obligation to help drive the supports and services that so many people need, using those federal funds rather than directing those to voluntary organizations. There is an obligation that those services are in fact paid and provided to people with disabilities. 61 million people. I am not anti-volunteerism in any way, shape, or form. But to optimize the use of the generosity of our volunteers, of our donors, we need to be holding government accountable for their obligations rather than having them referring folks into your very limited phone systems, your very limited healthcare systems. I understand that sometimes sounds like a radical or adversarial position. In fact, it's a huge opportunity to optimize those limited resources. And with all of the disaster dollars that get put on the table, and we all know the numbers are eye-popping. Every one of those dollars, every one of those billions and billions of dollars is required to comply with those Rehabilitation Act obligations that are now, 1973, they're almost 50 years old. Huge opportunity to work in collaboration to drive the obligations where they need to be met, rather than expecting that the voluntary systems are going to carry all that water. And the more that we use those resources, the more of these other resources, the voluntary resources, we're going to have available for folks. For example, the folks who are undocumented and have such a difficult time accessing the services that they need and certainly should be receiving. More resources for the medical care of people who are uninsured or underinsured. I could go on, I won't, but let's all just work together and let's, balance out who's doing what and stop pushing everything to the voluntary sector.
And I'll echo many of what my peers have said here in terms of online delivery for sure. I think we're trying to figure that piece out for where we can connect. And of the backup options, we're trying to plan a system where we know that we're in an environment that's potentially going to oscillate back and forth of being able to meet in person, not meet in person. So having, multiple implementation plans in place for our interventions is also what we're considering. But what I think is one of the most promising practices is not rocket science. It's actually something we've done for years, but I think people are open to it in terms of the working group that we started around the National Child Care Working Group, because what it's enabling is now it's not just a single territory, it's not just a single county that is being affected by a natural disaster. People are realizing that this is affecting everyone, and they're more willing to come to the table with their different expertise at different levels and really come around to problem solve, because it's urgent, and it's urgent for everyone. And so within that framework and in that mechanism of bringing together those different stakeholders, really from different levels, from local up to national, you are having people who are doing programs on the ground be the voice of what they need and why. And does that solve everything overnight? By no means, but it's giving creative problem solving. Hey, this issue is happening in Florida. It's also happening in California. And this is what we did about it. Or here's a template. We came up with a waiver to get supplies, which of course everyone needs. But guess what? Childcare needs supplies that are open, and they're serving essential workers. And it's really hard to get around. And so again, it's not rocket science, but in some ways it's going back to basics and bringing new people to the table because it's a new time and people are willing. And I think that's where the innovation is coming.
Sarah, one quick follow-up question. I know you're doing a lot of work in rural communities. Are there any specific programs that you're seeing there that have been successful? I know the digital divide seems to be highlighted in those communities. Anything you can share about that?
Well, again, kind of going back to the basics. I mean, what we're thinking about is not just digital and that backup plan. And so we are looking at how we are doing different modeling techniques. Some of that is online, some of that video of that parent-child interaction, knowing that, again, the parent is now the teacher for the child, and even, the primary caregiver potentially even more than they usually are. And the other thing is, program activity kits. And again, it's something that we can do at a wide scale level here with the VOAD partners, but instead of conducting groups of children in one area, what is the program kit and the guidance needed, whether that's virtual or even written down or an educational packet that the child and family can do together. So that, again, builds their relationship, hopefully in a positive way, but is also giving the child what they need if they're not able to go to school. And I think that I think, again, we're still kind of at the beginning of the crisis, and I think it's going to evolve, but that's kind of where we currently are and how we've been supporting particularly the education and psychosocial mental health supports.
And this is Marcy. If I could just add one thing,
Sure.
and let's be sure that however we're closing that digital divide or distributing information, it always needs to be in multiple formats. If we rely on any one format to share information or to invite people to participate, we're going to lose a lot of folks whose vision makes it difficult, or whose hearing makes it difficult, or people who have limited English proficiency, people who have low literacy, people with learning disabilities. There's no downside to using multiple formats to distribute information. It has to be accessible in order to be actionable.
Good. Now, I think those are all really good points as to specific ways that we can interject here. Are there any critical gaps in services that we're seeing? I think we've talked a lot about the challenges, but yeah, what is not happening now and probably could continue for a while?
Okay, I'll start. Oh, Bart, were you going?
No, please.
It's hard to tell in this interaction.
Yeah. I think there are so many things that are gaps. So one of the things that's been really hard for me to digest is the phrase that I continue to hear, which is, we could not have anticipated this. We had no way to know that this was coming. We absolutely did, but we did not use that time to invest in the resources that we should have invested in and to prepare accordingly. This is not the hand that we were dealt. This is the hand we chose. And that is the part that is frustrating to me, because every single gap that I'm seeing is a function of where we did not prepare and where we did not make intentional investments in the systems and the people that we knew were going to suffer. And so, again, it's across everything. It's thinking about, as you said at the beginning, who is vulnerable on a regular day, how many people, for us, one of the things that we continue to see is the number of people who are not in secure homes. And so if you are thinking about individuals, for example, who are escaping their home right now, we're getting messages and we're getting requests from people who are saying, I had to flee my home, it wasn't safe, and I forgot my meds. Can you help me get my meds? And I'm thinking, I want to help you do some other things too, but their priority is, well, I got out of the home, but I don't have my meds. There are gaps that essentially come down to, if you have more than one need in this moment, there isn't a system that is prepared to care for you. And that is the part that I think we all have really touched on in some way, shape, or form. If you have an intersection of what we consider to be medical fragility and social vulnerability, there is no safety net to uphold you. And that really is the gap, I think. And we had opportunities to prepare for this differently. And the other thing that I'm seeing and very concerned about, and I'm sure all of you are as well, is that the nonprofit sector, our NGO colleagues that are in this fight, are suffering. A lot of organizations that we would normally depend on, and a lot of the grassroots organizations who can take care of that service last mile for us, are suffering, and we're not sure if they're going to make it as organizations because they are gone now months without revenue. This is fundraising season for them. This is gala season. This is the time that they make the money that ensures that they will have the budget to fulfill their mission. And we have all been suffering, and we've had more needs rather than fewer. And so I think one of the other things we have to be really honest about is how the nonprofit sector is suffering right now, and what are the needs that we normally would fill in the gap for. But if we're seeing a lot of the organizations in the sector go away, those needs are still going to be there, but there's not going to be an infrastructure to uphold them.
I think those are fantastic points Nicolette made, and I think the gaps are far and wide on what people need and what they can do. I was remiss earlier in not mentioning telehealth, but to put a bright spot on this thing, I think that the things being done in telehealth, it's pushed us ahead several years getting ready to touch it, and I think that'll be something that survives the long-term impact of this, is that there will be more access to telehealth. People will be able to get mental health care via teleservices and alternative methods where they didn't have access before. The gaps are long and big, but I think there is some room that innovation has taken root.
Good point.
Go ahead, Marcy. We'll keep the same order. You go.
Okay. For me, the gap, I have to sort of reflect back on what Nicolette said. We absolutely saw this coming. And, oh, by the way, we have not somehow won the one disaster at a time lottery. Heads up, we just, here on the East Coast, we were just told there's going to be a much higher than usual hurricane season. Maybe that's true, maybe that's not true. But the gap, to me, is that every single time this happens, we're like, oh, who knew? And how many years and how many dollars have been invested in planning? How many times have we told people to have 3 days or 7 days, or wasn't going to help in this sort of situation? And it's not going to help if we have a Category 5 hurricane and a pandemic, or an earthquake and a hurricane and a pandemic. And so the gap, to me, is in our compartmentalizing the expenditure of bazillions of dollars and not really ever providing the resources to those nonprofit organizations that are now about to fall into the deep hole. We could have spent our money a whole lot better by making sure that Meals on Wheels was ready to roll under any circumstances. Imagine if we had invested $1 billion in preparedness funds on a system that works really well and could probably work a whole lot better if we invested in it. And I could point that out for so many other pieces of the really good work that I see who's on this call. Almost every single person on this call does incredibly good work. Let's divert the funds to where they're actually going to fill the gaps rather than continuing to admire the problem.
I would like to say that Marcy just took all my points and that I thought of them as well. But I mean, hurricane planning for sure, and just the overall lack in preparedness. I mean, it shouldn't have been a surprise, to Marcy's point. In terms of more specific kind of child-focused gaps, I would be remiss if I didn't bring up the fact that childcare is still not considered an essential service and not eligible for FEMA public assistance, and are not viable or strong candidates for SBA loans. And that leaves them very few options for getting back on track. And this is a huge problem, not just for people who have children. This is a business and economical fiasco, with potentially up to a third of childcare not being able to reopen when it's time, and even probably fewer quality childcares being available. And it's a chicken and the egg. We're not going to be able to go back to work if we can't find childcare, or maybe we can't afford childcare anymore. And that's going to change our whole economy. That's going to change our way of working. It's going to change the structure of childcare going forward. So this conversation will go long past COVID, as many of these conversations will. And then just two other points, I think you guys have hit on them. Mental health support, still huge critical gaps in the access, again, particularly for rural communities, and being able to access those. And the digital divide, we've gone so fast to try to get online, but there's just populations and groups of people that do not have access to what we're trying to do still. And that means that there will be certain amount of risk that we take as we seek to serve those families in the time of COVID.
Yeah, thank you for that. I think those are all excellent points. And, a lot of the issues we're pointing to are systemic, right? That we're talking a long time of issues piling on top of each other with a big pandemic falling on top, right? And so I think it can feel overwhelming, for the individual or the many voluntary organizations that are tuning in right now to say, okay, so we can't do anything, So for folks who are trying to really lean in to the needs that we're talking about here, what are some access points, some training, some resources that they say, I really want to help address X problem that they're talking about, food boxes in undocumented communities is a great start. But for any of you, what are kind of those access points or resources that you would point to help an organization get started in that direction?
Should I go first this time?
Sure.
I'll take the pressure off you guys. I always make you go first and then do the cleanup later. In terms of resources around children, supporting children, first of all, Save the Children has a lot of COVID specific resources at savethechildren.org. You might have also heard of our campaign Save with Stories, where different celebrities and individuals have been reading stories so that kids can listen to that while they're at home. But those tips include everything from how to talk to your kids about coronavirus, to tips for how to support their emotional well-being, tips to take care of yourself. And our education team is actually posting weekly educational activities that are free and available to download that you can share. And again, that kind of crosses the psychosocial support as well as some of the educational pieces. But there's a lot of really great other trainings available around, psychological first aid. I know disaster mental health hotline is out there as well. And Save the Children is here and, ready to support you. And, what are the needs? How do you want to train your volunteer force, your staff, for how to better work with kids? We do have the training suite available, and we'll be willing to work with people to figure out how we deploy that.
Great, thank you.
So I'll jump in. We have really been working on kind of doing two things. First, making sure that any of the questions that we receive the same question 3 times. We're putting out an FAQ, we're putting out a fact sheet, some cards that, are quickly accessible, making sure it's on social media, sending it to other partners, adding it to information and playbooks for hotlines. To Marcy's point about it has to come in a couple of different ways. So we have a lot of resources on our page, a lot of frequently asked question guides that are focused for patients, providers, caregivers. But we are also aggregating anything that our partners allow us to share as well. So my biggest thing on this is if any of us see something that one of us is doing great, we don't really have the time to try to reinvent the wheel. We don't have time for people to try to become experts in the things that they're not expert in. Let's figure out how to share those things across our organizations. I think one of the trainings we've been trying to do these kind of like flash trainings, like you tell me what your problem is, and I'm trying to get messaging around emergency refills to X population. And we'll say, okay, let's take 30 minutes and let's get all the people in the room around a webinar to be able to give you this deep dive and let you know what you need to do and how to plug into all of us. So we are doing that. If anyone needs that kind of assistance, just reach out to us. I'll put the email address in the chat. But that's the type of thing that we're seeing. I think a lot of hotlines are being really trusted. The disaster distress hotline, Sarah mentioned it, that's a great one. Another one that we don't often think about is Onstar. Onstar has a really impressive emergency management program. And if you as an NGO have a resource that you want to make sure is getting out, my kind of counsel is always reach out to Onstar, because they will not only include it, they will ask you what you need and if you're overwhelmed by their requests, but also the 2-on-1 system. And what we're finding is that those folks are actually staffing their people up so that they can try to take some of the burden off of us. So the more we can get that good information to those hotlines so that they can make it a little bit easier for us to do our jobs, the better.
I want to add to Nicolette's comments on not reinventing the wheel, right? We've been through these disasters before. We've seen things slightly different, but maybe dusting off old policies, old things that we did before, and thinking about them in this light, right? You don't have to recreate the whole thing. There are pieces out there. I mean, I'm now looking at things in light of killer hornets or whatever they're called. Great for them. So.
Yes, I haven't begun to wrap my head around the killer hornet scenario, but sounds like we need to get there. So there is a fabulous hotline that is run by the Partnership for Inclusive Disaster Strategies. I know many of you have referred to our hotline. And if you go to disasterstrategies.org, you can get more information. Experts on disability issues. Another really good resource, there are independent living centers. These are not residential places. These are community information referral advocacy organizations run by people with disabilities. There are about 700 of them across the country. They figure out tough stuff on a daily basis. They help people find accessible housing. They help people to get out of nursing homes and stay out of nursing homes. They work on a whole host of the stuff that confounds us in disasters, and they do it blue skies, steady state. So the way that you can find independent living centers, if you haven't already connected with them, is if you go to www.ilru.org. That's the Independent Living Research Utilization, ILRU. And they have a map, interactive. You can find those programs in the states that you're working in, and they've had way too much experience with disasters. They get very little funding, but they did just get a really nice chunk of funding in the CARES Act.
Great, thank you. Those are all amazing resources, and we're going to try to link to as many as we can in follow-up notes from this call. So I'm going to take a couple questions. I won't get to all of them, so sorry for anyone that submitted a question. So first one, addressing the stress people are feeling with the stay-at-home orders, any successful assistance for caregivers who are not getting any relief because no one else can come to the home, or any way to get a break or extra support for those scenarios?
I mean, I think it's a little bit about prioritizing. I know that's hard to say, but how are you getting your stress relief, even if you have to be with your child, or is it when the child is sleeping? Are you doing your activities together? But you have to take care of yourself. But if you think about what we tell people when they get on airplanes, what they say, put on the gas mask to yourself before you put it on to the child. And that's because if you aren't taking care of yourself, the child is looking to you on how to respond. And if you don't have the mental capacity, the emotional capacity to support them, they're not going to have what they need to get through this situation. So it is a little bit about how are you making sure you're finding you're getting your exercise, eating right, taking some time for you. And I'm not going to find you extra hours in your day, but it's really making sure that you do take that self-care aspect of it. It's crucially important. Sometimes I think we push it off to the side, particularly as emergency response organizations. We're like, we got this, we're used to this, but you're not excluded from that. You have to make sure that you take care of yourself, because we burn out just the same.
I am very sensitive to the fact that not everyone has the ability to step away. And I want to really lift that up, because I think there are individuals for whom this pandemic has been a worst case scenario in terms of the different parts of their worlds in which they have had to hold up at the same time with little support. And I think that is where you start to say, you can't have a friend just come over and watch your kid for a couple of hours, or your adult parent that you're caring for, right? You could be in the caregiver role for a lot of different people, or many people at the same time. We've seen some technology solutions lean in and say, either we're going to, the kind of the Sesame Street, and, Sarah was talking about like the celebs reading to your kids approach to like just sit your kid in front of the TV for an hour and like hopefully we can help give you a break because, Michelle Obama's reading a children's book to your child, that kind of thing. But the alternative is we've seen apps, and I don't want to list out any because I know I'm going to forget one, but telehealth apps have actually been leaning into what does it look like to give e-consulting. A lot of the remote therapy options have been offering free hours. A lot of the insurance companies, even for folks that are not in their plans, have been doing the same. So my counsel is it takes a little bit of work to try to find those. And I think we all could probably do a little bit more work to think about like how we just find those resources that have been stood up, those programs that have been stood up, but really amplify them. And then to the point where things can be made easier. So a lot of the chain pharmacies are doing free mail delivery of prescription medicines. When you're a caregiver, that matters. So you don't have to go to the pharmacy, you can automate it. And not only are you getting your emergency refill, but you don't have to leave the house for it. So to the extent that free programs are available to be able to easily plug into them and have those things that might take 30 minutes, might take an hour, be made a little bit simpler. And then the disaster distress helpline, for example, I keep pointing people there because I can't remember all of the other programs, but I know that one. The 211 system is another one where you say, if you're not sure where, what exactly you need, you can call and be talked through these things. And so I think we really have to start lifting up some of those processes that are not overly burdensome, but can really help make people's lives easier.
Those are all fantastic resources. So this is a little specific, and hopefully we'll be talking about this on next week's webinar. But how would you set up a MARC, multi-agency resource center, virtually to serve mainly the undocumented with about a 35% positive rate at a plant? So I'm assuming they're talking about a factory worker plant. This has been done before, and hopefully we're talking about it next week during next week's webinar. But any strategies for bringing multiple agencies together to help support a specific population, I think would be the broader question.
This is Marcy speaking. Sorry, I spend a lot of time on calls where we introduce ourselves. So I would ask that disability organizations be invited to the table. We welcome the opportunity to be at the table and to help to navigate the variety of accessibility that would make this work for folks. And as deeply committed as we are to the wide range of immediate needs that folks have, I think there is a particular concern about folks who are undocumented and have disabilities. I would do whatever I possibly could to support an initiative.
So an off the top of my head idea for this specific example, or bringing people together in a MARC, there are a lot of virtual gala softwares out there where people can attend a gala. That might be a great place to showcase each particular agency. We're not prevented, it's a little scary, but we're not prevented from doing some events outside and spacing them out. So if you had a large enough place, perhaps you had one local day for those people who don't have access to technology. But any of the gathering sites, maybe even a Zoom meeting would be difficult, and then just showcase what agencies are there and how to contact them later on.
Interesting.
I love that idea. The only thing I would add into that is if you're able to do that, thinking about like the plant example, oftentimes there may be a healthcare facility within driving distance. And the reason I bring that up is if you're thinking about a 35% positive rate, you're going to need two things. You're going to need a testing capacity, and you're going to need some sort of medical triage capacity. So being able to partner with a local clinic or a pharmacy, for example, often a pharmacy with a parking lot will work with you to be able to set up a testing capacity. You're also going to need EMS, because if you need to be able to run people from that plant to the pharmacy, or if they're positive from that pharmacy to the facility, the hospital, that is a solution, and that is a partnership that could be set up. So it doesn't require physical infrastructure, but if you have those people in one place and you're expecting that you're going to have that high of a positive rate, you're going to need to plan for what it looks like to partner with that local healthcare capability to be able to triage and then send them to healthcare.
Those are all great ideas. Thank you. Well, we are over time, unfortunately. I know we could talk for a long time about this, but thank you to all of our panelists. I truly appreciate it. And I hope for everyone that was on today that you can figure out what your small piece of the pie is to serve these populations. And, there's a myriad of resources just on this call. And at National VOAD, we're committed to helping, make those links for you. But thank you so much for all that you do. And I hope everyone stays safe and well in these times. Thank you.